Thank you very much, Dr. Njoroge, for that wonderful welcome. Hello, everyone. As mentioned, my name is Samuel Mbugo, or Samuel Mugai Mbugo. I'm a nurse by training and also a public health specialist. So I am honored to be here. I'm honored to be able to take you through this session on an introductory phase of first aid. And the principles involved in first aid. Please feel welcome. I'll divide the session into two. You're welcome to ask any questions during the first session. So without wasting much time, I'll quickly delve into it. We'll first begin by defining two quick terms, two very important terms when we think about first aid. And also just to build up on what Dr. Mary Mugwe has well covered on school health and other facets of social determinants of health. When we think about the health of a person, a student, even our own health, we're usually plagued by situations that present life-threatening scenarios. So a medical emergency in that case would be a situation that presents with or presents one person, an individual, with a life-threatening situation if not treated immediately or managed with quick precision. While first aid, on the other hand, is the immediate, the temporary care that is administered or given to a person in distress. This person in a life-threatening situation before regular or specialized medical care can be availed. Please note, very importantly, that first aid is not restricted to the physical, but also involves psychological support as well. And this, we shall see this shortly, why the psychological support comes in. But why is it? Why is first aid important in a life-threatening situation? It can help to save a life. If you think about anything that involves resuscitation or helps to extend a person's life before a trained health provider can get access to the person. So first aid, and it's important that as we go through it, we think about it in simplicity and then build up on the knowledge we already have. Just to get an all-rounded view of what we would do in a medical emergency. So important here to save a life, to reduce pain, very important, because pain is one of the most important human responses to a life-threatening situation that might involve injury. Next is to prevent further injury, further deterioration. For example, if you get to the site or the scene of a medical emergency, your quick response will ensure that a person does not get, for example, if they have a simple fracture, that it doesn't complicate and might even result in an amputation in a worst case scenario. So preventing further injury, very important. It also reduces the risk of permanent disability. Because the mitigatory measures we take early are very critical towards ensuring that disability and complications of an emergency are prevented. It also increases the chances of early recovery for a patient or a client or a student for this matter, because early measures taken early are very important in going back to what we said earlier, prevention of further injury, prevention of complications. This increases the chances of a person's quick recovery, hastened recovery. Immediate action is very important, hence, when we think about quick recovery. For example, early access is the first step in the chain of survival, and quick action is critical towards saving lives. What you do initially is very important and does not mean, for example, it does not mean the following: panicking in case of a situation. It's important to be quick, calm. Very important to be controlled and thoughtful. Okay? These are very important contributions when you think about immediate action. Now let's think about the chain of survival, which involves three critical circles. One is the early access to a patient. Early adds on to the value that we get from immediate action. All right. Then comes early CPR or cardiopulmonary resuscitation. Very important, and this can further be broken down into early cardiopulmonary resuscitation and defibrillation as well, and we shall see that in this next slide. Early advanced care is also very important. This involves the healthcare provider and ensuring that the child gets to a trained healthcare provider early. So please note that the first two links in this chain of survival, that is early access, early CPR, and early defibrillation, are very critical when we think of ourselves as first aid responders. So the chain of survival, as I had said, can be broken down into these four circles. The first circle, which is early recognition and the ability to call for help. This is important because it prevents cardiac arrest. Very important because cardiac arrest and also cardiopulmonary resuscitation, for that matter, is very critical here as in terms of first aid. Then early CPR, early cardiopulmonary resuscitation. This is vital because it helps us to buy time by restarting the heart, for example, ensuring that there is adequate respiration and ventilation to our patients. And also, it helps us to ensure that the patient reaches a healthcare provider early in time. Then we've got early defibrillation, which involves administration of an electrical impulse to the heart. And this is if a patient's heart has stopped and you need to restart it. And then we've got post-resuscitation care. This is administered by healthcare providers to restore the quality of life. All right. Now let's look at universal precautions that we need to think about in first aid. These are actions that are taken to prevent the spread of disease by treating all blood as if it were contaminated. And it's not just blood for this matter. Think about any fluids, any secretions that are from our clients, from a patient, from a student, treating them as if they were contaminated. Now, we've learned this very well during this COVID pandemic. What actions do we take to prevent the spread of a particular disease? Could be bloodborne, could be airborne, by ensuring that we follow the following precautions. One is wear protective gloves when treating a patient, if available. If not, take necessary measures to ensure that your hands are adequately cleaned before and after administering first aid to a patient. Use a face mask or a face shield when giving first aid in case of ventilation or breathing emergencies. Again, very important. A shield is something that can be placed over a patient's mouth while giving mouth-to-mouth breaths or ventilations. Covering any open wounds on your body with sterile dressings, even on those of the child or the injured person, is very important. This is critical because it helps prevent onset of sepsis and infection. Avoid touching any objects that had contact with the victim's blood as well. Important because this will help us to prevent, again, transmission of any infection. Always wash your hands thoroughly before and after first aid, for this matter, if, for example, you do not have protective gloves. So those are universal precautions we think about when you think about infection prevention and control. Let's think about how do we recognize signs of an emergency. This involves using our 5 basic senses of hearing, sight or vision, smell or olfaction, and this will alert you to most emergencies. For example, listen if you hear people calling out. This will alert you to an emergency situation. A strong smell that might elicit or come from an infected wound, for example, might even cause stinging of the eyes, might cause a cough, or make breathing difficult. These are signs of a toxic gas release, for example. So use of your senses is very important in recognition of an emergency. Making a decision to take action involves evaluation of a situation and deciding on what action to take or what is needed. So your first responsibility in any life-threatening situation is your own safety. Please always note and underline that somewhere within your thought process. Your own safety is critical and is your basic responsibility. Please ensure that you never put your life in danger with the thought of helping someone else, because if your life is in danger, their life is also in danger. They're in the same situation you're in, and none of you can help the other. So don't put your life in danger, even if it involves an emotional response to someone we deeply care about. For example, our students. Do not put your life in danger with the thought that you might be helping them, because two people in the same pool means you're all wet, so no one can help the other. Who needs first aid? What are the likely scenarios that would require administration of first aid? Involve cardiac and respiratory arrest. Someone has stopped breathing, or someone's heart has stopped beating. An electrical shock, which again would cause a cardiac arrest. Someone with a wound, could be a penetrating wound, it could be a simple abrasion. All these are different types of wounds. In case of bleeding or hemorrhage, okay, someone has gotten involved in a life-threatening situation that involves fire, burns, and burns can be different types of burns. It could be an electrical burn, could be it could be a thermal burn, different types of burns. Fractures and traumatic injuries as well. Poisoning, drowning, very common, especially in young people, because they are very prone to try new things. Someone would want to, swim through to the deep end of a swimming pool, and they don't exactly know how to swim properly. And even snake bites, okay? People who come from rural areas or places where there's heavy vegetation, snake bites are quite common. So what are the aims of first aid? Again, preservation of life, okay, because you aim to save a life. Prevent deterioration of injury or illness. Very important. Complications, this is where we come in with prevention of complications. Promotion of quick recovery, and to protect an unconscious patient. This is important because an unconscious patient is not able to respond to stimuli. They're not able to tell you that they're in pain. So their protection in a first aid or in a life-threatening situation is important. Now, how do we preserve life? Ladies and gentlemen, it involves checking, clearing, and maintaining the airway to ensure that there's adequate oxygenation and ventilation into the lungs. It involves checking and clearing as well as maintaining breathing. This involves, for example, if we need to perform cardiopulmonary resuscitation. The breathing exercises and administration of ventilation is part of this maintenance of breathing. Checking and restoring as well as maintaining circulation involves ensuring that there is adequate cardiac output And this will entail making sure that the patient's heart is beating. Yeah, because as long as the heart is beating, blood is being circulated. Maintenance of circulation also involves, for example, thinking about bleeding. If someone is losing a lot of blood, then which is what we refer to as hemorrhage, it might lead to what we call hypovolemic shock. The body does not have enough blood circulating. So wound dressing, placing even a tourniquet, all these are measures to ensure that we restore and maintain circulation. Controlling bleeding again comes in here as that last portion when you think about circulation. And also treatment of shock, as I've mentioned. It could be management of the presenting type of shock. And we've said we've got several types of shock. It could be neurological based, which means the nervous system is involved. It could be due to septic shock, which means infection is involved. It could be due to hypovolemic shock, loss of significant amounts of blood, resulting in hypovolemia. So all these are key principles when you think about preservation of life, and brings in the three critical systems that are required for preservation of life. That is the pulmonary system, the cardiovascular system. Okay, these are very key, and to a large extent, the nervous system. Now let's look at prevention of deterioration of injury. How do we prevent that a particular patient or student who has been injured in a life-threatening situation, their injuries do not get worse? Okay, number one, never move a casualty, and a casualty from henceforth is anyone who has been injured. So never move a casualty unless it's absolutely necessary. Also ensure that when moving a casualty, be extremely careful. And this will bring into focus again if you're moving an unconscious or even someone who has been involved in a traumatic injury. Why one of the key areas that we look at is ensuring that we protect the head and the neck. And we'll look at this in our second session. Covering the wounds is important because it helps prevent complications associated with sepsis. Immobilization of fractures, again, to prevent other complications associated with discontinuation of a particular bone, for example, like compartment syndrome. Once you mobilize a fracture, you help to protect other structures around it, like other blood vessels and other even nerves, for example. Checking for other injuries, very important, because that which is not obvious is probably the most significant or life-threatening one. For example, someone has been involved in a road traffic accident. Most injuries, or some injuries here that occur, involve significant internal injuries. You could have a lacerated liver or kidney, for example, from a road traffic accident due to blunt force trauma. You will not be able to see this unless you check thoroughly for other injuries, other signs of buildup in fluid, for example, in the abdomen. If you suspect that someone has some sort of internal injury. How do we promote recovery and protection of the unconscious? One is treat the injuries in a correct order. Start with the most severe. The most serious is what we start with. Give comfort and protection to your casualty or the person who has been involved in a life-threatening situation, and then relieve pain. So start with the most significant injuries and then cascade downwards. Reassurance is very important as part of psychological support in a life-threatening situation. Because without reassurance, most people tend to act in hysteria. So being able to calm your casualty or calming down your student or your patient is critical towards recovery and even their own protection. Gentle handling is critical, and we'll look at this again, as I said, in the second phase, and positioning the casualty in a lateral position, which we refer to as the recovery position. The lateral position is where you lie the patient on their side, and with one arm under the head, protecting the head from the surface below, and the other hand lying next to the head. And we'll look at this again in our second session. General principles of first aid. What are these principles that we need to think about every time we are in a situation where we're first aid responders, or first aiders for this matter? One is always obtain qualified help as soon as possible. Call 911, call the nearest healthcare provider who is qualified in provision of first aid care. Next is avoid any unnecessary movements of the victim. Do not move a victim unless it's absolutely necessary. Reassuring the victim, again, as part of psychological support, is very important, while you ensure that you use a confident, a calm attitude, which is important because it helps to relieve a victim's anxiety. Avoid giving the victim anything to eat or drink, because you don't know what if they might have ingested a toxin, for example. Protection of the victim from cold and chilling is important, but avoid overheating. Okay, placing a blanket around your victim is good in a first aid situation, but placing 5 blankets, on the other hand, will be tantamount to overheating this patient or this casualty. When you think of ourselves as first aiders, think of the work that you're about to do. Work in a quick and organized and efficient, methodical manner. All these are important. Just like we think about our work, organization and efficiency are very important in first aid. Do not make a diagnosis or discuss the condition with observers at the scene. Right? As teachers, we don't want to discuss a student situation with other students or other teachers at the scene of the medical emergency. This is not right. Maintenance of confidentiality and protection of the casualties or the victim's privacy while providing treatment is a thought that should always be at the back of our heads. Okay, regardless of the gender, it could be a boy or a girl. Confidentiality and privacy are very important while providing treatment. Ensure that we take or make every attempt to avoid further injury to the casualty. Provide only the treatment that you have been trained or qualified to provide as first aiders. Don't take measures into your own hands, for example. If someone is bleeding profusely and you have never taken a suture or know what a suture is and decide that you're going to sew a person together, no, this you're not qualified for, because the management or the attempts to help this patient might end up further injuring the casualty. Examination of the patient should always be done gently. And please, ladies and gentlemen, let everything that you do have a reason. Let it be informed by a decision or having evidence for why you need to do what you need to do. Okay, let's not act out of panic or hysteria. Let's have a reason for anything that you do, which takes me back to the previous statements that I had mentioned. Being calm, composed are very important in provision of first aid care. Let's think about the golden rules of emergency care. what to do. What should we always do? One is obtain consent to try and help the patient whenever possible. Okay, especially in responsive clients, always ensure we get consent. Thinking of the worst is important because it helps us to take preventive and protective measures. Call and send for help, right? Always have the emergency number at hand. As teachers, as care providers to students and even to our fellow colleagues, being able to send for help is important. Identifying yourself to the victim is the number one rule in emergency or care provision. Please always ensure that they know who you are and how you're trying to help them. Provide comfort and emotional support involves reassurance, respect of the victim's modesty and physical privacy. Going back to what I had mentioned earlier on confidentiality and privacy. Caring for the most serious injuries first is in emergency care. This is very critical. Remember, we said we need to prioritize the injuries and the care that we provide. It brings into perspective a different notion of emergency care referred to as triage, and this is done by first aid or first responders, healthcare providers who respond to a medical emergency first. They always try and identify the most critical patients first and tend to them first. Okay? Those who have life-threatening situations classified in red, then they're the ones who can get care maybe after a short duration of time, about 30 minutes after the most critical have been catered to. And there are those categories of patients who can get to a hospital and get help from there. So this helps us to ensure that we try at least and save everyone. Assisting the victim with his or her prescribed medication as necessary is important because, for example, if your patient or your student is a diabetic, it's important to first identify whether or not they have any other chronic condition, for example, in this case, diabetes. Helping access their medication could be their insulin injection. It's very important because it will help you alleviate a complicated situation that would require significant medical attention. Keeping onlookers away from the injured person is important because ventilation, I know people love to crowd around an emergency situation, but keeping these people away is important to ensure that there is appropriate ventilation atmospherically for the injured person. And also, when you think about privacy and confidentiality, handle your victim to a minimum. Remember, we said have a reason for everything that you do. Loosen all tight clothing to assist with circulation. Splinter any injured parts in the position that you find them. Do not attempt to reset, for example, an injured, a fractured, or even dislocated limb. Do not attempt to reposition it in the appropriate position. Let that be the job of a trained health provider. Because sometimes, for example, if someone has a dislocated arm and you want to reposition it, you twist it in the wrong direction, you cause significant nerve injury, and that person can end up with partial or significant paralysis to that arm because you tried to reposition it, or even end up causing further damage, fracture, and even tearing blood vessels. Prevent chilling, but do not add excessive heat. We mentioned this, and stay with the injured person until a trained medical care provider or transportation, this being an ambulance, arrives. Now, what should we not do in an emergency situation or during provision of emergency care? Please, let's not try to arouse an unconscious victim. Let them remain as they are. Do not remove any penetrating objects. this is very important, ladies and gentlemen. If you find someone or a young student has fallen off from a tree when they were being adventurous, maybe trying to pick some fruits, and they have a penetrating injury to the abdomen because one of the, loose objects or sticks quickly punctures through the abdomen, do not try and remove this object. This object actually cannot be removed until we get to a health facility, one with an appropriate surgical team awaiting. Because usually when an object penetrates through the body, it causes damage to blood vessels. And removal of this object would cause significant bleeding, which might be life-threatening compared to if you left the object in place. Do not try to give anything by mouth to an unconscious person or anyone with serious injuries, and do not let the victim see his or her own injury. Also, do not leave the victim except if you need to get help. And always, let's try not to assume that the victim's rather obvious injuries are the only ones that they have. Remember, I said earlier that assessing for any other injuries is very important, because that which you obviously see, just because a person has a grazed knee, does not mean that that is, or those are the only injuries this person has. Do not deny a victim's physical or emotional coping limitations. For example, if someone needs to cry, let them cry. Reassurance is the key. Telling them not to cry is not what we're looking for, but reassuring them that you're trying to help and you're going to try and ensure that they get the best care possible is the goal here. Do not make unrealistic promises. You get to the scene of an accident and you tell someone that everything is going to be perfectly fine. Now we'll be lying. Because, of course, if they have been injured, for example, if someone has, you get to the scene, and I'm terribly sorry to give this example, ladies and gentlemen, but if you get to the scene of a medical emergency and let's say someone's leg is lying a few meters away from where they are, and you say that they're going to be okay, let's not give unrealistic promises. If you said, for example, that you will try and ensure they get the best care possible, or you're trying to help them to the best of your ability, that is a promise, not an unrealistic one. Okay? Do not trust the judgment of a confused victim. If someone's orientation to place person and time, for example, is off, they do not know where they are, and you ask them how are they feeling, they tell you they are absolutely fine. This is a sign of someone who has a bit of compromised level of consciousness. So ensure that you carry out your own quick physical assessment to see if they have any other injuries. Do not require the victim to make a decision. All right, this is not the job of the first aider. The requirement of a victim or a patient or a casualty to make a decision requires a proper, thorough medical assessment, all right, and the presence of a trained healthcare provider. Do not move the victim unless the rescuer and casualty are at risk from further injuries, or if it's required for first aid to occur. And so remember, let's not move the victim unnecessarily here. Two situations might prone you or prompt a first aider to move the casualty. One is if the rescuer, this being ourselves here, and the casualty, our students, are at risk from further injury, or if where the patient is or where the casualty is, first aid cannot occur, then you're allowed to move But remember, ensure that you take measures to protect critical parts. For example, head and neck. They should always be stabilized before you move, and the spinal cord. Reassurance. Let's think about psychological support here. One of the key things, one of the most critical things that we can do to help a casualty is to reassure them. This keeps the casualty and yourself calm and will assist and ensures that as much medical treatment or medical help and attention can be provided is accessed. You may also need to reassure the relatives and bystanders who remember. So, for example, if a young student has been injured and their relatives or parents are around, this could be a significant hindrance to provision of emergency care, because they probably think they know best, and they think that in that moment, in that bit of psychological shock, that they want to be with their loved ones, but really they need to stand aside to allow you, the first aider, to provide emergency care. So after an incident or a casualty, take time to tell everyone involved how important their contribution was and if the outcome was successful or unsuccessful. It's important. Okay, did you manage to preserve life, prevent complications? This is critical to as part of reassurance. Stress. Now, stress. And in this case, I want us to think about stress when we think about ourselves. As a first aider, you may have an emotional reaction, especially if you had a significant connection with a casualty. Stress can appear either immediately after an incident or even months later. You are a first responder or a first aider when there was, for example, a road traffic accident that involved students. And ladies and gentlemen, these are scenarios in life we don't like to think about, but it's important for us to be prepared if these situations occur. So if you, for example, there was an accident that occurred that involved a few of the students that we have been with for quite some time. An emotional reaction involving these stressful bits can occur. And signs of stress that might present include frequent crying, difficulty in sleeping. Maybe we might even act out in anger. Apathy. Apathy is acting like we don't care or nothing phases us. An increase in drinking or even drug use. Anxiety, very important. Anxiety and fear. Flashbacks that might cause even us to have, for example, moments of phasing out, delayed action in our day-to-day lives. Headaches, stomach problems, loss of appetite, depression, and even sadness. All this, if any of these signs of stress, or what we call PTS, post-traumatic stress, occur, get professional help if it does not resolve. And it's important to sit back after an emergency situation, talk about it with a few people. Talk about what you saw, what happened. It helps us to kick in our coping mechanisms, because failure of our coping mechanisms results in post-traumatic stress. So if an emergency situation occurs, and I'm talking this to even the managers who are in this session, that look, it's important to let our people take time off, relax, find something that takes their mind off things to try and relax and mitigate against a stressful situation. Hence brings me to this: after an incident, an emergency situation, a life-threatening situation. And please note that your involvement does not end when the casualty or when our student leaves or gets better or goes to the hospital. Please take some time after us to take a breath, take a break, talk about the incident with others, relax. Okay, clean up the scene and equipment. And importantly, please let's not forget to ensure that or first aid kits are restocked. Whether it be it in the school bus, be it in the school itself, be it in a classroom, or even the staff room. Ensure that your first aid kit is appropriately stocked. And you can have monthly checks and inspections to ensure that this particular area is well stocked. So a quick review of what happens in an emergency situation. Remember, we said safety first. Your own personal safety comes first, so safety assessment. Then comes the response, calling for help or shouting for help. Support the head and neck if you need to move the patients. Then if a patient's key critical systems required for survival are compromised, then ABC or cardiopulmonary resuscitation kicks in. That means ensuring that you have a patent and well-maintained airway, breathing and ventilation are taking place, circulation, okay, by controlling bleeding and ensuring that the heart is beating. Then do a quick secondary survey. Look at the patient again, look for other signs and symptoms of other injuries that might not be very obvious. Do a quick history, not a very thorough history, quick history to find out what happened, where were they when something happened, all right? And then from here, ensure that there's appropriate and authorized transportation to a hospital involving an ambulance with a paramedic team if available. So for the next few minutes, before we take a break, I want us to look at what all these stages involve, from safety assessment all the way to transport in the hospital. Safety assessment is ensuring that the scene is safe right before you enter it. If not, please remember, like I said before, you are of absolutely zero help to anyone if you're injured or hurt. If your casualty or your student is in danger, move him carefully without putting yourself in danger. Again, taking care of the head and the neck. Bystanders can be very important. They can help protect the scene and also can help you as a first aider to call for help. Response. How do you respond? Check to see if the casualty is responsive. If they can be able to respond verbally and in action and they are conscious, ask the casualty what happened, where it hurts the most. Right? If they're unconscious and unresponsive, assess the airway, breathing, circulation, and signs of life, the ABCs. And we'll look at this when we look at basic life support. Be prepared to perform life-saving techniques in the name of resuscitation. Controlling bleeding. Try as much as you can to stop it quickly by putting a thick dressing over the wounds and applying firm pressure to it. If the wound is on the limbs, elevate the limbs to ensure blood flow is towards the heart and keep the patient calm and still. Very important as part of reassurance. Let's try and use gloves as much as we can and try not to touch any blood or any fluids or any secretions from a patient, especially if you're querying that it might involve some sort of infection or sepsis. Support of the head and neck is important in case of an accident that involves a fall, a car accident, or even speed or velocity related injuries. Ensure that your patient or casualty remains still. Support the head and neck by placing your hands over the ears. Okay, so on the sides, on the temporal bits of the head to hold the head still. If there's no obvious neck damage, please always ensure that you assume the worst, especially in unconscious patients. Always assume the very worst. A secondary survey occurs after you've ensured that airway, breathing, and circulation are intact, and any major hemorrhage or bleeding has been stopped. It involves checking the rest of the casualty or the patients, assessing them quickly from head to toe for any signs of injury. I said head to toe, so start from the head and move downwards to the feet. Use your hands to ensure that you compare both sides of the body at any particular time. All right? So this ensures that you move systematically, looking at both sides of the body in a symmetrical manner. History involves asking the casualty what happened. Okay. Ensure that you get a thorough and ample history. Ask them, do they have any allergies, any medications that they might be on, their past medical history, even the last meal that they had, and what were the events that occurred preceding or that occurred leading to the accident. So thorough history helps us to get information that might be critical to further management of the casualty down the road. So ladies and gentlemen, looking at my time, I would like to pause there and just to get a feel of where we'll be going to next. There's a bit about transportation. So after that, I think we shall look at what are the contents of a first aid kit, a home first aid kit, as we move forward and look at other critical components of basic life support. If I'm allowed, Dr. Njoroge, can I pause there?
Thank you. Very good exposition. We have really benefited, all of us, including the staff who are in. This is very good for the teachers. We understand the environment that we have. We want to take this opportunity to thank you for that exposition. And it's now 1 p.m. We allow you to have a health break. We are with the good doctor with us. He will come again in the afternoon, complete the content. I would assure you, Mr. Mwangi, that the questions are here, they're overwhelming. We will discuss and respond to them later in the plenary. There are many questions that the teachers want to understand. Like, how can one help someone who has been bitten by a snake? There are many questions. How do I protect a child from domestic violence? I know some are Dr. Mirimowe, some belong to you. So we want to thank you, Mr. Mwangi, sincerely for the exposition. Maybe we can have lunch, and then we come back at exactly 2 p.m. You get a new link. So teachers, ladies and gentlemen, we want to thank you sincerely for choosing Mount Kenya University as service provider of choice for the TPD program. And 2, for joining today's webinar. And I think now we are running, and I appreciate the comments which are coming through. Kindly don't worry about the assignments. We will give you 1.5 months to go through every activity and respond. So the concern now is get the content first, so that we are able to respond and get the content for effective teaching and for improving the learning outcomes. And eventually, our Kenyan child has learned, and we are all a happy nation. So thank you so much once again, Mr. Mwangi. Let's meet in the afternoon. Thank you. Then we went through the concept of school health. Now we engaged, before we went for lunch, we engaged on first aid by a very, very able doctor, Mr. Samuel Mwangi. So this afternoon I would like for him to continue. Daktari, take your time. Explain the rest of the aspects and meaning to our teachers so that they can give a good learning experience at the ground, and when injuries or fractures occur, or when there is issues that occur, health issues that occur on the ground, they may be empowered to be able to help to help their learners and also their fellow colleagues, because the injuries can occur from either end. So I take this opportunity to welcome you to this afternoon session. Dr. if you can hear me, pick it up and continue. Mr. Mugai?
Thank you very much, Dr. Njoroge. There seems to be an overlap with your audio. I think I just want to confirm if I can be heard clearly.
Yes, I can confirm that we can hear you loud and clear. Maybe let me ask ICT to drop the slide so that you can be able to share yours. Director, yeah, thank you. You can go ahead.
Thank you. Thank you very much, Dr. Njoroge. Now, I feel like there's a delay in the audio sound. I'm not very clear about it. Dr. Njoroge, are you there?
Yes, we are hearing you, but there's a little delay. I don't know.
I'm not sure where the issue is.
Maybe you have joined using two teams. You can put off one. Hello?
Sorry, allow me to drop this and then join again.
You want to join again? You are back?
I'm back. Can you hear me now?
Now, loud and clear, better.
Fantastic. I am terribly sorry. I think I probably joined using two links. You're right.
Thank you.
All right. So if you just a quick confirmation, if you can view my slides on contents of a first aid kits.
The slides are clear, contents of a home first aid kit.
Great. Thank you. Ladies and gentlemen, picking up from where we left off, I just want to get a feel of what we anticipate to find in a first aid kit at home. Some of the basic contents include sterile gauze dressings to help with our wound dressings, adhesive tape again to help with wound dressing, calamine lotion to help with, especially in children or students who we cater to help with skin outbreaks, elastic bandages, antiseptic solutions, antibiotic cream, elastoplast band-aids, which ideally should come in several sizes, a cold pack, and we'll see how that looks like in the coming slide, which helps with wounds, especially wounds that are bleeding and even inflammations. Triangular bandage, we'll see what that is for, especially for our students in sports. Scissors, tweezers, acetaminophen, ibuprofen, these two are painkillers. A flashlight, gloves, thermometer, and even a first aid manual, and a blanket for cold insulation. So this is what each of these should look like. We've got bandages on your top left corner, adhesive tape, gloves, even safety pins, a triangular bandage, thermometer, and so forth. And this is how it looks like in real life. We've got the crab bandage at the top. We've got gloves, band-aids in different sizes, as well as painkillers, and even wound dressing and gauzes, and even a face shield, antiseptic cream, and so forth. So this is an ice pack or an instant pack. You're supposed to squeeze it until the inner pouch bursts out. Shake it well to mix the contents after activation, and apply the pack as desired. Okay, for about 30 minutes. This helps with reducing swelling. This next item here is what we call a tweezer. It's used to remove not penetrating, but objects that have been embedded within the skin, just up to a certain level. You can use a tweezer to remove maybe a thorn that has gotten into someone's arm or leg. And this is a triangular bandage. It's very critical if you're going to mobilize the upper limbs or the arm. And that is how you create. And you can create a triangular bandage with anything, including a piece of towel or even a sheet around you. You just need to make sure that the larger lower surface of the arm is covered under and it goes around the neck in this position. An industrial first aid kit, on the other hand, has additional components within it. For example, an eye patch or an eye wash. This is in case someone has had a solution or a chemical that has gotten into the eye. Okay, an abdominal pad to help with penetrating abdominal wounds that have been left gaping. Other components include a burn relief gel, safety pins, and the others are more or less basic to the home, or more or less compared to the home-based first aid kit. Now, let's look at what is basic life support and why is it important for us to learn about it as first aiders. Basic life support refers to the type of care that first aid or first responders, healthcare providers, and public safety professionals, of which I think in this group we have first responders, who are we in this session, as well as public safety professionals. So the type of care that is provided by us to anyone who is experiencing a cardiac arrest, respiratory distress, or an obstructed airway. If the ABCs of resuscitation are compromised, then this is basic life support, the care that is provided, that is. So this necessitates knowledge and skills in cardiopulmonary resuscitation, as well as the use of an automated external defibrillator, or AED, and relieving obstruction within the airway in patients and casualties of all ages. A quick overview of basic life support involves an action plan. What plan of action have we put in place? Right? The first step is danger, assessing the situation and your safety for you and the bystanders as well as the casualty. Please be careful to look out for cars, fires that might be existing, gas, electrical lines that might be lying around, or any other potential hazards. So remember, safety comes first, as mentioned earlier. Then assessing the response, just like we looked at earlier, involves 4 key things, or what we call the AVPU scale. It assesses for alertness, response to verbal stimuli, that's the V. P is response to painful stimuli, and the U is if the patient is unresponsive. So for us as first aiders to be able to assess for response, we need to ask, command, or even shake the casualty. And that is the AVPU scale. Now, checking for response might mean shaking the shoulders gently. Please note, underline the word gently. Asking out loud, are you all right? If the patient or the casualty is responsive, leave them as you found them. Okay? Try and find out what is wrong as well, and then reassess regularly if the ABCs are not compromised. If they don't respond, first thing, shout for help. While you're assessing the airway now, okay, let's check. We always use a maneuver referred to as the head, tilt, chin, lift maneuver. Okay, so you first begin by stabilizing the head using one hand, as the gentleman is illustrating here. As you can see my cursor on the patient's forehead. All right, then tilt gently, ladies and gentlemen, gently tilt the head forward, and then lift the chin. Okay, so this is supposed to open and create a patent airway. Now, if you suspect there's been a spinal injury or an injury to the head and neck, then do not use the head tilt chin lift maneuver. Rather than that, you should go for the jaw thrust technique. This involves placing your hands on either sides of the face, and with your fingertips, you will gently lift the jaw, as demonstrated here, to open the airway. It is very important that you do not tilt the casualty's neck. You just use the fingertips to gently lift the jaw to open up the airway. And from here, we can either give ventilations while supporting this with compressions. Now, ventilation or breathing. We assess this by looking, listening, and feeling for breathing. Very important. If you do not breathe, or if you do not detect breathing, that is, assist by giving 2 artificial ventilations at the rate of 1 ventilation every 5 seconds, and we'll look at this bit of resuscitation shortly. And this is how it's done. In this day and age, with this pandemic, ensure you use a protective shield to create a barrier between you and your casualty to reduce the amount of aerosolized particles and other microorganisms that you might be sharing with your casualty. Other forms of ventilations are highlighted here. On the top right corner is where we use an ambu bag, right? Also called a resuscitaire, to give ventilations. The one below there is where we give air. If there's blockage to the upper airway, then we'll give ventilations through what we create a tracheostomy. It's a small hole you create here through to the trachea. Now this requires a health provider to administer. And this is what we call the barrier method, where we create a barrier using an additional mouth-to-mouth device, as illustrated. Assessing for circulation. Remember, we're going through the ABCs: airway, then breathing, then circulation. Let's ensure that we check and palpate the carotid artery, which is located just below the mandible. All right, and this is palpated by placing the index and the middle finger to feel for a pulse. Just below on the side of the neck and above, just below the mandible. Assess for the rate, the rhythm, and the strength of the pulse. Pulse is absent, give 30 chest compressions. Okay? Chest compressions, and I'll show you how we do this, which is approximately 2 inches, like 1/3 of the chest, or 6 centimeters into the chest, after you have located the position of the heart. Chest compressions, I had said 5 to 6 centimeters or 2 inches. After you locate the chest, then interlock your hands with the base of one of the hands or the dominant hand lying on the chest, and then go deep, 30 compressions in 1 minute while giving 2 ventilations. Okay, so 2 vents for 30 compressions with a total of 5 cycles, and then reassess again after 2 minutes while you call for help. Then, as help is being sought or arrives, continue with cardiopulmonary resuscitation while waiting for said help. So in summary, basic life support goes through an acronym we refer to as DRAP. Right? Always reassess and assess again and again for danger, checking and removing the casualty from a dangerous, life-threatening situation. Assess the response by asking, commanding, or shaking the casualty. Assess the airway and ensure that you have an open, patent, and you maintain said airway. Okay, you could use either of the 2 maneuvers as mentioned, the head tilt chin lift maneuver or the jaw thrust technique if you suspect spinal injury. And then assess breathing. If absent, give 2 ventilations and 30 chest compressions at a rate of 2 vents to 30 chest compressions for 5 cycles. Then again assess while calling for help, then reassess and go through the same process again. So this is a quick summary of basic life support. Please remember, ladies and gentlemen, it has several other components to it. This is just a quick overview of what we'll be doing in case we're going through cardiopulmonary resuscitation. Modifications to an adult CPR would instead of following the airway breathing circulation approach as we've discussed, begin with circulation, that is chest compressions, then airway followed by breathing. Why we have this modification? Instead of ABC, we go with CAB, is we need to commence with perfusion of critical organs, beginning with the brain and the heart, fast, without delay, because compromise of either of the 2 creates an irreversible, complicated situation. For example, if there is delayed perfusion to the brain, then the patient might end up in a vegetative state, which is, next to impossible to reverse. Delay to the heart means essentially patient will be, when you think about the cardiovascular system, will be essentially dead. So it's important that we reverse and begin with prioritizing circulation, the airway, then breathing. Sorry. So if cardiopulmonary resuscitation is not required, then again, assess the danger, the response, airway, breathing again. Then place your client in a recovery position, or the casualty in a recovery position. And if we go back to the earlier session, I had mentioned about the recovery position, which is on the lateral, or putting the patient or lying the patient in a lateral position. Now, only stop CPR. Only stop CPR if the victim or the client starts to cough, opens their eyes spontaneously, starts speaking, has purposeful movements. If the movements are confused, then do not stop CPR, because it doesn't indicate recovery or maintenance of either the cardiac, pulmonary, or circulatory systems. If the patient starts breathing normally, if you get a normal respiratory rate, and if there's more than one rescuer, for example, then you might change over, or with the presence of what you call a resuscitator, every 1 to 2 minutes to prevent fatigue and tiredness in one rescue. Avoid any delay during the changeover, because we don't want to interrupt oxygen and blood supply to vital organs. And do not interrupt chest compressions. Once they begin, please finish. Because again, remember there's a cycle. For every 30 compressions, give 2 ventilations. Okay, so if you interrupt a compression cycle, then we will not be able to account for how many compressions have we given in the past half a minute. Meaning we would extend the duration of time for which our victim might go without critical oxygen that they require. So recovery position is or can be for an unconscious casualty who is breathing and has a steady pulse. And this is the position. Remember we said the patient has to lie in the lateral position, one arm under the head and the other one lie next to it. And this is how you put a victim in a recovery position. Okay, raise the left arm up and put it at a right angle next to the head. Take the left arm, put it across the face, lying on the cheek, and then using the left leg, turn the patient to lie laterally. This is referred to as the recovery position. Remember, only if the patient is breathing normally and has a steady pulse. So, ladies and gentlemen, that is a quick overview of first aid. Just a quick recap. Most importantly, when we think about this second session, think about this DRAB, assessing danger, response, airway, and breathing. Okay, this is very important before we move and then begin CPR. Depending on the patient that we have and the age of the patient specifically. If it's a young child, please remember CPR changes. There's a variation again. Okay, we do not use both hands for a young child under 1 year. We use the two thumbs placed on either side of the chest to give compressions. Okay, and again, ventilation changes, but that is part of advanced basic life support. So I want to stop there, and I want to now, without wasting much time, ask for any questions that you might have. And I also want to thank Dr. Njoroge for this opportunity to facilitate this session. Thank you very much. Again, I did not intend to take a lot of time this afternoon, knowing how we usually are fatigued in the afternoon. So we tried as much as we could to cover majority of what we should have covered in the earlier session. Dr. Njoroge, over to you. Thank you very much.
Thank you, Mr. Samuel, for the engagement, for the good presentation. That was wow. We have really learned. And I don't want to speak on the behalf of the teachers. They have a few questions. If you spare some little time to respond.
Of course, yes.
Let me share with you so that you can be able to respond. There are quite a number, but maybe you pick those you feel. The rest we can be able to share with you. You develop a response to them, and then after developing the response to them, we can post them in the wall, and they will be able to see. That will help everybody to all the questions they have asked will be taken care of.
Thank you.
There it is coming in. Maybe you can drop your slides.
Right away.
Thank you. Yes, so what I did was to synthesize what our dear teachers had put on the wall. We will give the feedback, and one of the things that you have been able to address is, if you don't mind, please use simulations. I and many others prefer this to lecture. So we can also do something small for them to be able to see the simulations, which you have also attempted at the very end. So let me go to the questions that touch on the area. So I have picked this one from the question and answer. So compliments. Thank you, sir. You are hitting the nail on top. I feel like already I am a first aid specialist. That's a compliment for you. Then now we got the questions. Maybe I can scroll. You can respond.
Yeah.
Go ahead.
So thank you very much, Dr. Njoroge, and the many compliments. If I may go to the first question, what are the remedies for injuries at school? This question is quite welcome and very touch critically on what we do every day. Now, the technicality involved here is that the injuries that might occur in schools are vast, and there are so many. It could range from a simple sprain to a fracture to even chronic condition-related complications. So the question here is rather broad, and I will answer it as such. It depends on the injury. Remember, the key to first aid is not to provide remedy. We're not supposed to treat. Let's leave that to health providers. Ours is to provide first aid care in an emergency setting. So, for example, if one of our students has a fracture or even a dislocation, first aid care dictates that the first thing we should do is immobilize the joint or immobilize the injured part, depending on the type of injury. An immobilization could require 2 sticks and a piece of cloth to tie around. So, answer to that question is the remedies or the first aid care is dependent on the type of injury and level of emergency care needed. There's a teacher Kamal asks, how can one help someone who has been bitten by a snake? Thank you very much, Kamal, for this question. I want us to listen keenly to this. In case of a snake bite, ladies and gentlemen, ideally, the first thing we need to do is, if you can, immediately move away from the area or remove the victim from the area where they were bitten. Remove anything that is tight around the bite area. It could be from a bracelet, rings, or even anklets, because this can cause significant harm if swelling occurs. Reassuring the victim is very critical here. Please remember that many snake bites are non-venomous. But even with venomous snakes, the risk of death is not usually immediate. So immobilize the person completely by splintering the limb as well. Please remember, I know this contradicts a lot of what we know and we have used, but it is important to never use a tight arterial tourniquet. It has been shown to cause significant and worse damage by creating a tourniquet. A tourniquet is where you tie something above the area that has, or just proximal to the area of the bite. Let's not do this. What you can do is apply pressure to the bite area with a pressure punch. Do not use any traditional first aid method. Do not try and suck out the poison. Do not try and cut the area with a knife or slash it with a knife or cut it in any way. Let's not do this. Priority with first aid is to ensure that this patient gets quick transportation to health facility as quick as possible. You can give a painkiller if available, but remember, first aid here priority is to take the patient to Mama Blessing says, first aid session looked after first year class for medical students. I thought all schools were supposed to have nurses to deal with such situation. This is giving teachers a lot of responsibility. Mama Blessing and everyone involved. This introductory phase to first aid is important because those few minutes before the nurse gets to where the emergency situation has occurred are the most critical. And all the things that we have learned here, that you might have picked up here or there, could be critical to prevention of complication and even saving your student's life. So anyone, trust me, not just as teachers, even administrators, even people who work in office, basic first aid knowledge is important. Right? The first year class of medical school is quite intricate. This is just an overview to help us, even at home, if there was an emergency situation, to help us cope with it. Dr. Njoroge, those are 3 questions. I think, okay. Salome, kindly include epileptic attacks, such as seizures, in your discussion on first aid. Many people remain helpless when any seizure attack occurs, and this is common in institutions of learners with special needs, I think. So when it comes to seizures and convulsive episodes, if I might call them that, the management of such is purely based, again, on whether or not you can get access to a trained first aid responder. But the first aid of it, if Salome, you're with me, is quite basic. Number 1 is remove any objects around the student or the patient or the casualty. Okay? It is very common that we try and put, for example, a spoon. Please do not try and do this. Okay? Let them pass through the seizure episode, put them on an open area. Normally these seizures do not last very long, but the most important thing is to get help as soon as possible. Okay? While if they recover, then put them in the recovery position and look for transport to the closest health facility. I do not want to get into the nitty-gritties of seizures and any neurological related occurrences or complications associated with decrease in level of consciousness for any of our clients. Please remember is to ensure that we do not try and immobilize the patient, because if you try and restrict the patient, then it could lead to even fractures and other injuries that could have otherwise been prevented if we let the seizure episode pass. Again, if the patient has medication close by, please ensure that is always at hand, and as teachers in our presence, that we are aware of any patients that are prone to seizure or epileptic episodes. Hysteria, very common among female learners. Is it considered an emergency which requires first aid? If so, then how does one go about it? So, yes, hysteria is common among female learners. It depends on the cause of hysteria. Is it considered an emergency? Yes, because of the proclivity that these students have to self-harm. How do you manage hysteria? It involves reassurance. If hysteria is known, right, if it's a known occurrence in a particular student population, management of it starts from the very get-go. It involves creating an atmosphere whereby, or grouping even students in a way that we've got students who have a certain level of confidence together with students that are known to have, how do I say this, to have outbreaks when certain events occur that they deem as negative in their lives. So this emotional state is usually temporary, but its management is purely based, again, on the school system. So is it considered an emergency? It depends on the level of hysteria and how many, female students are involved. I would leave that quite open, because then it goes then to the realm of psychology more than it does for the medical angle of emergency care. It's great learning about first aid through various complications. The question in case of dealing with emergencies so as to administer first aid: how should the teacher ensure precautions, since not all schools have nursing stations and first aid resources that a teacher can access? Equipment such as gloves to avoid simple contamination through blood, etc. Especially in this era when diseases are identified in people and spread of life-threatening contagious diseases is high. So in this case, the very bit about emergency, remember we said we began by covering the principles of first aid, and that first initial bit was on purely infection prevention and control. In this day and age, I think every institution should have at least access to face shields, face masks, gloves, precautions associated with first aid. For example, access to a first aid kit, training for first aid for at least 1 or 2 or 3 teachers who can even go through basic life support is absolutely important. So all these are resources that within our institutions we can even lobby to get. And trust me, a box of gloves is not very expensive. It would not set the institution back more than 400, 500 shillings per box of 200 pieces. So having areas, designated areas, just like we have designated areas of, for example, fire assemblies. Let's make sure that our first aid kits are well equipped. Just even based on the overview of what I have shared with you today, on what are the components of a first aid kit, ensure that all these basic things are available, basic components, even not just gloves to wound dressing material to antiseptic equipment. On equipment, so contagious diseases is high. So remember, in this COVID era is where scenarios have changed to life-threatening contagious diseases. Unless, and I want to say this to everyone, because in this era where pandemics have become quite frequent in the last 20 to 25 years, please note that our ecosystem as it is designed, it is not designed that contagious diseases are on the high. COVID pandemic has proved that a lot of infections can come through, but only if there has been zoonotic transmission, which means transmissions from animals to human beings. Life-threatening contagious diseases are not that frequent. In the last few decades, besides COVID, the only other life-threatening condition of that magnitude that has been on the outbreak has been the Ebola virus, which has been predominantly in Western Africa. So I wouldn't say life-threatening. Contagious diseases can be managed, but remember, infection prevention and control guidelines that we have within our institutions are what will dictate whether or not there will be spread of a contagious disease, even through blood or any other secretions. Zainab asks, the first aid topic seems like it requires a medic to handle it. How can a teacher who has no basic medical information handle the serious cases? Again, I go back to what I had mentioned a few minutes ago. This information shared today is an introduction to basic first aid care. It does not require medical information or critical training For the serious cases, serious events, leave to the professionals, leave that to us. But for first aid, for you to be able to save a life, move a life, or just extend the time that a person has before they get access to a trained healthcare provider, this is the importance of this training. The serious stuff, leave it to the healthcare professionals in the healthcare facilities. So just for emphasis, this does not require medical training. This is need to know for everyone, even in the homes that we live in. Robert asks, what will I do in a situation my loved one is in a house on fire and is really asking me for help? Do I have to consider my safety first and let them die, really? Robert, this is a very good question. Because it brings about what you call compassion. Compassion, and how does it affect our decision making? Now, in this situation, Robert, where a house is on fire and your loved one is involved, if, Robert, you are not a trained first responder, in this specific case, if you do not have protective equipment and cannot manage the fire adequately for you to get to your loved one, then you running headfirst into a burning building does not help your loved one. Because both of you, and I'm sorry to say this because this is quite common, both of you might end up perishing. And it did not help your loved one, it did not help you. In case of a fire, most of the time, people do not die, or people do not get significantly injured by the fire itself. What they get injured from are what we call inhalational burns. So rushing fast in the hope of helping someone in a situation that you cannot quite assist it does not help, to be honest. I know the amount of decision making that requires you to make an empirical, logical decision not to go in first is not something we think about. So please know, your safety comes first at any one time. It might affect the fact that another loved one will not get the care you could have given because you went in head first and ended up being a casualty as well. If you're administering first aid, are you supposed to make the victim lie down, face up? This is a very general question. Remember, administration of first aid is not cardiopulmonary resuscitation. Please remember that. First aid is dependent on the situation and the type of injury that your casualty or the victim might have encountered. Depending on the situation, or if you need to perform cardiopulmonary resuscitation and the victim lies in a supine position, that means they lie facing up. Okay, they lie down facing up. But to underline this, please note that first aid is dependent on the type of care you need to administer. If it's cardiopulmonary resuscitation, then the victim can lie in a supine position facing up. Winnie asks, my school, most of the accidents that call for attention are learners being unconscious in the name of... Dr. Njoroge, please scroll down. Dr. Njoroge? Thank you. Accidents that occur in Winnie School are learners being unconscious in the name of Pagawa Namapepo. Interesting. It's disturbing and scary, hence we might find such real cases and we assume Namapepo. What do I do? Really, I don't know where your school is. I would love to visit your school because I feel like the learners maybe need a bit of sensitization. Regardless of the interpretation of the causative factor, mapepo, kupagawa na mapepo, that is, all this. Remember we said first aid is not just the physical, but it's also psychological. So reassurance starts with you. I'm pretty sure even the ones when you're, pagawa na mapepo, if you reassure them, and for you as a first aider, please remember, for you as a first aider, your own emotional and psychological response is absolutely critical. If we could put aside our other beliefs and focus on our victim, then first aid purely requires you to reassure your client. After that, the psychological help that such learners might require the help of a psychologist or a counselor who will need to talk to them about their psychological welfare and how they interpret socio-cultural practices in the communities they come from. Chege asks, what do you insinuate when you say one has to be conversant with the matter? Suppose an accident occurs and one is not conversant. How will you advise such a case? When you mean conversant with the matter, you mean, I'm hoping you're referring to the medical emergency itself. And in this case, if you do not know what has occurred, then it is very difficult for you to know what to do or how to interpret such an occurrence. Remember, we said this, from the get-go, safety comes first. So if you arrive at the scene of an incident or an accident and you don't know what has occurred, it's very difficult to then interpret how your own safety and the safety of your casualties as well as bystanders is affected by the situation. So if it's a road traffic accident, you need to first assess the area, understand the level of involvement, even of bystanders. We've seen scenarios where you arrive at a road traffic accident scene and we quickly manage the people you see around. But then you don't see the ones that were flung out of a moving vehicle into the nearby bush and they are unconscious. So you're required to quickly understand the situation, understand who was involved, and information from bystanders, even the critical victims who might be conscious, is very important in this case. Next question. Dr. Njoroge, do you have another one? Or that's it? So maybe as Dr. Njoroge checks if we have any additional questions, I am very welcome to any other questions if you post them in the chat or if you share them with these sessions administrators, then I can always respond and you can get the posted answers later. I'm very happy that we've seen so many questions, especially even involving other socio-cultural beliefs. We've got a question from Musyoka, who asks, in an accident, who do you attend to first? A person crying for help and a victim who is silent, whose condition is not evident. Musyoka, good question. Now, a quick analysis of an incident is very important. In case of an accident, for example, when you say who do you attend to first, a person who is crying for help or the victim who is silent? Now, the victim who is silent in this case could have a significantly worse condition than the one who is crying for help. Remember, our own response, how we react to certain situations, is also based on our perception of said situation. There are people who perceive pain differently. If someone is in significant pain, they'll be very quiet. Someone who is in a scale of 1 to 10, pain is scaled as a 2 or even a 1. They are crying out. Based on our own emotional reactions to certain stimuli, then it is very important as a first aider to take a critical look and assess quickly and see who requires care urgently. It could be, your situation will not even be limited to the two types of people, the person crying or the person who is silent. It could be someone who is unconscious. So if you get to the accident, you ask, for example, who was seated next to the point of impact? Assess them and look at the level of injury as you trickle down to other people. Factoring in other components like age. Could be someone who is very young or very old. They are more prone to significant injury than someone who is of, a proper adult age. As you factor in other conditions that people might have. This is part of what we call triaging. So triage means cater or look after the most sick first, and then group them in three groups. Those who require immediate care, those who require care after a few minutes, and those who can wait until they get to the hospital. So this requires a bit of medical training, but as a first aider, look at the most critical sick first. Next question is, how can one offer first aid to a kid who has a fracture? This answer to this question is very simple. Immobilize the fracture. Immobilization as it is. It doesn't matter in what direction the distal or the lower extremity is facing. Immobilize it. Okay, that means maybe taking two pieces of wood and then putting each on the sides of the leg or the arm, tie something around it and take to the hospital. Do not try and do anything else. You can give a painkiller for the pain. How can I help a student with epilepsy who falls frequently and gets injured? Again, I go back. So if this is a known epileptic, a person who gets convulsions or gets injured, it's important to always ensure that their medication or their management is, or they follow their treatment plan, number one. Number two, you always have someone trained in first aid around them. Even their own friends can have quick, the other students that they hang out with can have a quick orientation that if they fall down, please ensure they lie down. Once the epileptic episode passes, then you can bring them to the school clinic. Okay. Can a teacher involve the parents of the sick child immediately after first aid, or is it wise to report to administration? I think the policy here is dependent on the school. Okay. I think depending on the situation, reporting to the school administration first, and then which would then trickle it down to the parents. Coletta asks, suppose you're not in a position to handle the first aid case and share with a staff mate. Have you broken the confidentiality rule? It depends on what did you share with your friend or staff mate in this case. If it's intricate details about the case, remember we said it's okay to talk about the scenario, not the person that was involved. Okay. Privacy and confidentiality means do not share critical information that you think, if it were you, would you have the information out there? So discussing what occurred in a particular incident is not bad. Confidentiality means discussing your patient or your victim with your staff mate. If you are not in a position to handle it, then sharing it, that is not confidentiality. That is not a breach of confidentiality, that is. That means you're looking for someone else who can help in a situation that you are not well equipped to handle. Next question, how do you attend a case where a child has taken many painkillers or any curative drug in the attempt to kill him or herself? So this is a case of suicide involving taking medication. Remember, we do not know what type of medication they took. Most important thing is, number one, call for help, call for medical help. Then from there, we'll be able to assess, depending on what they took, if it's painkillers, please note that do not try and elucidate or cause vomiting. please seek for medical help first. The rest would handle from there. We'll see what sort of counter agent we can give. From this list, I think, Peter, what can a male teacher do in a critical situation in the case of a learner of opposite sex in a male-studied staff when carrying out first aid in the face of danger? Please note, Peter, first aid has nothing to do with the sex. If you're objective, which we all are as teachers, our main objective is our students. So if it's first aid and you're required to carry out first aid, for example, CPR, please perform CPR in an objective, ethical manner. No one will ask you what happened or why did you decide to do what you did. In the face of danger, remember, first aid, those critical measures are critical, are very important, that is. So, when you say male-studied staff, I think there's always a female somewhere who might be able to help in a situation that you cannot, or you feel puts you in an ethical dilemma. But remember, our principles of interaction stand. Just like they do stand in a classroom, even in this scenario, they should take precedence. Wandabwa, will this episode be available on the wall or through the... Please scroll down, sir, Dr. Njoroge. I need to see, oh yeah. Will this episode be available on the wall or through the 30 years of training? It's very critical. I think Dr. Njoroge is best suited to answer this question, but I think it should be available. Koech asks, kindly recap what to do if the victim is unresponsive. It depends. It depends on the casualty, actually. Is the casualty breathing? If breathing and pulse are present, then place the patient in a recovery position. If they are unresponsive and there's no pulse, then again, you can go through the AVPU scale, check for alertness, voice, response to voice prompts, pain, and then if they are responsive, shout for help. If you need to clear the airway, head tilt, chin lift maneuver. If you suspect jaw thrust, if you suspect spinal injury, then you can use the jaw thrust technique. If unconscious, then CPR is the same to if they were conscious. I think the follow-up questions are for the ICT team, I believe. Thank you very much, everyone, for your time and your many questions. If you have many more, please post them. I'll be happy to respond. Dr. Njoroge,
thank you, Dr. Ali. Thank you for that well-taken response. The teachers are appreciative of you. Maybe two issues. One, when there is hysteria, I see teachers use maybe paraffin. They dip some handkerchief in paraffin, and then they allow the student to sniff. Some use the spirit from the gas lamps. Maybe you can address that. Question number two. With the hysteria, some teachers pick a stick and hit the child, especially the girls. have seen this in schools. Number three, when there's a epileptic maybe child who falls, who becomes a victim at a point, I see some people put spoons in the mouth. Maybe you can address the three items.
Thank you very much for those questions. Now, on the hysteria, on what is done, especially in our institutions, what socioculturally we have used, for example, paraffin. This is not supported medically. The actual management for hysteria in this case is usually what we refer to as supportive psychotherapy. If it's in critical conditions and these patients have chronic mass hysteria, then maybe use of antidepressants and other methods of psychotherapy are prescribed. But the key here is what we call somatization. and how to ensure that our students have adequate coping skills. Because, for example, if you use a piece of cloth dipped in paraffin, how many times do you intend to expose them to petroleum-based agents, which, again, are not very healthy? So I'm a big proponent of following the science. If the science does not support the use of certain methods, then let's try as much as we can to avoid them. Appropriate psychotherapy and a lot of counseling is what is prescribed here. Putting a spoon in someone who's having a seizure episode in their mouth. Remember, I said, please, let's try and avoid this. Management of seizures, and even trying to protect, for example, the idea here is we'll be trying to protect their tongue or from biting their tongue. And let's not try and do this, because if they bite you, they can even bite your finger off while having this episode. So using a spoon is not or should not be prescribed. Access to anticonvulsants, and again, if it's a non-epileptic, access to their treatment, anticonvulsant medication promptly is what will help with management of this episode. There was a third question, Dr. Njoroge. Please remind me. Or maybe I've responded to both.
Sorry, we had asked 3 questions on hysteria. The issue of putting the spoon.
Yes.
The issue of putting the spoon in the mouth.
Yeah.
Then hitting that child. I've seen those ones happen. Or maybe using spirit or the paraffin.
Yes. So for the hysteria, let's not, hitting the child does not help. I again go back to coping mechanisms are what we need to help develop in these young minds. Because every time they're exposed to a particular stimuli and hysteria is the end result, then it just means psychologically their coping mechanisms do not kick in appropriately, or the right coping mechanisms are absent. So hitting the child, use of paraffin, all these are contraindicated. Supportive psychotherapy, on the other hand, can be quite useful. Even the use of sports has been shown to show significant, encouraging, positive results, because all they need is to find the appropriate release so that they're able to manage these situations. Thank you very much. I hope I have addressed the issues.
Thank you so much. On behalf of the teachers, let me invite Dr. Mary Mugwe to appreciate Dr. here. Dr. Mary Mugwe?
Here?
Okay, go ahead.
Thank you. Mine is just that simple task I've been given. Samuel Mogai, we have been with you today. Hi, how are you, Mogai?
Very well, Dr. Mogai. How are you?
I'm well. Always very, very happy to listen to you. As everybody else is saying, you are so clear in what you are saying, very articulate. And we have been able to learn a lot. Just like everybody else is saying, would like to listen to this presentation over and over again. Being that we are in this chapter with the Dean and you came in to offer what is needed, your expertise in this, we are very, very grateful. And we know anytime we need you, you'll be coming. I cannot forget to thank our Dean for being there and making sure that we are okay and we are proceeding well. We are happy I know you don't even sleep thinking about how we can make things better, and that is what we always pray for, a sense of excellence and hands-on, and that's what you have been able to do. Then for ICT Director, thank you so much, Vincent Karoro, for being there for us. We know you are also working very hard behind the scenes. I know if we have shown what you are doing, some of us cannot handle it. Our Director, Kimodo, you did a very good recap in the morning. We appreciate. For all our listeners, we are grateful. We have been able to get your feedback, and we cannot thank you enough. I know I had just been asked to thank Samo But again, thank you for allowing me to thank everybody else. Back to you, Dean. Thank you.
Thank you, Dr. Mugwe. We want to thank Mr. Samuel Mugai. When I engaged him to come and facilitate teachers, he didn't hesitate. That's the rough he has of sharing his knowledge, very rich knowledge, vast. You are very articulate, and you have demonstrated your expertise. And the teachers are really happy, and we all appreciate you. So we want to thank you, and we wish you well. I know you are still willing to come back when we call you again, because I know teachers want to hear something else. Let me release you so that you can attend to other patients. So kindly, you can say goodbye, and then we release you.
Again, thank you very much, everyone. Dr. Njoroge, Dr. Mary Mugwe, Director ICT, everyone involved in this forum. Thank you for inviting me. And yes, I'll be happy to come back again if you'd invite me. Thank you very much. Good afternoon, everyone. Cheers.
Thank you. We release you. Kindly to attend to others. We wish you well. Let now.